You're tuned to Fresh Air Community Radio, KFAI 90.3 FM, HD Minneapolis, and on the web at kfai.org. Tuesdays at 1 p.m. It's Conversations with Al McFarlane.
There will be no more racial war. They will respect us for who we are. The greedy man's well will run dry, and he will watch his children cry. And he now knows that's how it feels.
You can hear Al here every week at 1 p.m. and view him live on Facebook Live through the Inside News page. Coming up, Al McFarlane.
One day, children, we will watch when the tables turn.
Ladies and gentlemen, Al McFarlane.
Thank you, Mason. Thank you, Mason. I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Glad to be here and glad to be with you today. Wow, what a beautiful day. And this is weather, sunshine that I think we deserve. And so we have to simply appreciate it, love it, and go enjoy it. And even if, snow and rain may be in the near future, we've got a taste of what's coming. And I think it's going to be a glorious summer. And I think what's coming includes what's coming in terms of what people are referring to in part as a reckoning. I think our community, our society is looking at itself differently. The world is seeing itself differently. So I'm pleased to have a conversation today with a person that I've known for a long time, who I believe is at the center of both thinking and action around creating a better community, a community in which equity means something, in which equity is a property and an asset that invites all to understand their role, their ownership in creating community, creating personal health and collective health for our community. My guest is Andrea Walsh. She runs the Health Partners, Minnesota-based Health Partners. It's the largest consumer-governed nonprofit health care organization in the country. And throughout her career, Andrea has been passionate about health and committed to making a difference in people's lives. Today, she runs a team of more than 26,000 people, all focused on the mission of improving health and well-being in partnership with its patients, its members, and the community. As a disclaimer, I want to indicate that Al McFarlane and family are passionate and satisfied members of the Health Partners system. I've been a Health Partners patient personally for 25 years now. And I think I've known Andrea about that long as well when she first started there in the early 90s. Andrea, good afternoon. Welcome to Conversations with Al McFarlane. How are you?
Doing well, Al. Thanks. It's so good to be here with you today.
Well, it's so good to have you in the conversation as well. I want to tell people that I'm looking at notes that indicate that you are a Minneapolis St. Paul Business Journal's Executive of the Year for 2021, and you got the award because of outstanding leadership involving the expansion and serving your insured and parts of your team, and navigating your company through both the COVID-19 pandemic and the tragedy of George Floyd's killing. So let me start with that. Let's talk about COVID-19, first of all. From your position as a CEO of a large, major health organization, what's the status? What do we need to know so that we're better informed as consumers about how we navigate, come through, survive the challenges of COVID-19?
In some respects, it's hard to believe it has only been a year since the first patient with COVID showed up in the state of Minnesota. But wow, what a year of unbelievable challenge for the community and for the health of the community. I'm feeling optimistic today, and I think it is due in no small part to the fact that infection rates are down, the number of people getting vaccinated are up, And I think as a state, we can feel proud of the partnership that's happened across community and with community to make sure that people know and understand the importance of wearing a mask and staying socially distant and washing hands to prevent infection and spread. And then, of course, now the conversation around how important it is to get a vaccination to prevent catching COVID in the first place.
How does a company like Health Partners answer in two ways? A big company, first of all, retool itself to make its employees safe. Add to that the specific mission of an organization like yours, and that's providing and protecting the health, of its members and of our community. How does it happen? I read in the notes that when maybe back in January or early last year, you convened a leadership team. This was around the time you had patient one, maybe just before, just after, and everybody was on the second floor conference room, imagining this U-shaped table. And then within a day or so, everything had to change. Nobody sitting crammed together, people socially distanced. So you learned as you were doing, you're learning to fly as you were building the plane. Talk about that whole process. What happened at your company and at big companies?
Sure. Yeah. So I think for all of us across the community, health and safety became the number one priority, and getting to know and understand how could we protect our patients and community members, and how could we protect our care team members so that they were able to provide care needed in the community. And in those early days, just about a year ago, at that point in time, we still weren't exactly sure how infectious COVID would be and exactly how it spread. You might remember there was discussion of PPE, personal protective equipment, and just what that equipment needed to be. And unfortunately, there was a big shortage in that equipment as well. So we had to take steps initially to confine care and suspend care beyond COVID care to just what was absolutely necessary in hospitals. And so literally, our clinics and our dental clinics had to suspend care across the community so that we could preserve the equipment, the personal protective equipment needed to safely care for patients with COVID or without COVID. Fortunately, that situation changed a lot over the course of the year. We became much more knowledgeable about how to care for patients with COVID. Personal protective equipment became much more widely available. And then over the course of the year, of course, we watched as infection rates rose and fell, and then rose once again towards the end of the year. So I would say our organization has learned a lot. It became really necessary for us to think not only about community and the communities around our clinics and our hospitals, but it became really important for us to think about all of our capabilities across the entire Health Partners system. So if we had a patient show up at Regions Hospital who needed critical care, we could provide that care right there. If we had a patient that showed up in Amory, Wisconsin, in one of our critical access hospitals in Amory, who needed care in that hospital, we could provide it there. And if the care became significant enough that intensive care was needed, we could transport patients. And we literally, during the surge, needed to use all of our hospital beds across our 8 systems and move patients back and forth to make sure that the care that was needed we were able to provide it in different locations.
How much of a challenge was it to retool both the knowledge and skill set for your employees? How big an operation was that? How much of a disruption was there? Or is it that your profession, by nature of what it is, was adaptable easily, seamlessly, quickly?
Yeah, I think we learned a lot, and our focus on high reliability and quality in healthcare. I mean, we carefully engineer a process of care to make it safe and to ensure that the right steps are taken every step of the way. So you think about a surgery, for instance, and you may go in for a knee surgery. You want to know that the care process to get your surgery on your knee is planned from start to finish. And so we took that same deliberate approach we have in ensuring quality outcomes for any kind of care and applied it to COVID. So we would make sure that the care was safe and that we were using the best evidence available. And I think that was the other challenge as it relates to COVID is the science has emerged over the course of the last several months. And what was true last March and April, we now know more about the disease and we know more about how to care for patients with the disease. So our length of stay, the number of nights you might spend in a hospital today versus what it might have been a year ago, we've cut it by more than half. And it's been a result of continuous quality improvement and learning more. And as we learn more, disseminating that out across our entire health system.
Do learnings from the COVID-19 experience translate into learnings in other areas of care?
Yeah, I think they definitely do. Maybe as an example, when we needed to suspend care in our clinics, we immediately moved to using digital capabilities, video visits, for instance, and over the course of 4 days, trained 1,900 clinicians from across our system to be able to use a video visit as a way to take care of patients. And we've found great receptivity. Our patients want it to be simple and easy. And that using technology actually was something we found greater receptivity by both our patients and our clinicians.
So moving forward, what do you see as the country and hopefully your clients are embracing the vaccination? What's your experience so far in providing vaccines to your members, to your clients, and to the community? What are your expectations, and how do you see the end that we hope is near revealing itself in the next months or year?
That's a great question. You know, I think our experience to date has been there are more people wanting a vaccine than we have vaccines available. And so a little bit like the personal protective equipment early phases of the pandemic where there's more demand than there is supply. It's been 60 plus days since the vaccine has been available. And I can tell you we have way more patients that are raising their hand saying, I want a vaccine and when can I get it? The good news just reported today is the number of people 65 years and up who've received vaccine. We prioritize the elderly first because the health risks for hospitalization and death are far greater for population 65 and above. Within Minnesota, I think today the percentage of 65 plus who've been vaccinated is up around 68%. And I think in the next couple of days, it'll exceed 70%. That's really good news. I think one of the areas we've been focused in particular at Health Partners, and frankly, the state has been focused on as well, is the issue of health equity. How do we reach into our communities of color and make sure that there's access to vaccine? You think about chronic illness and disease in communities of color and the disproportionate impact on health in communities of color, and that has been a heavy emphasis for us at Health Partners. We want to make sure that our Black, Indigenous, and people of color get vaccinated, and that we don't have a new healthcare disparities gap where we have more white people vaccinated than our Black and Brown patients.
That's a big issue. You know, I before the show, Andrea told you that my wife Bobby and I have received both of our vaccinations of the Moderna vaccine, and we're happy for it. And I've told this story a few times, but I'm pleased to tell it again and again. We went to a clinic right here in our neighborhood. I live in North Minneapolis, near the corner of Plymouth and Penn. But on that corner is the storied health resource for North Minneapolis called North Point Health and Wellness. We knew it as Pilot City way back in the day. And so when Bobby and I pulled into the parking lot at that building, and took the elevator up to the 5th floor where North Point has their headquarters, but they have conference space that they turned into a vaccination center. We were met by 3 workers at the elevator who were wearing the mask and shields and gloves and gowns, and each of them had a thermometer, and smilingly, and the emphasis here is on smilingly, they took our temperatures and they asked us the regular questions we've become used to. Have you been out of the country in the past 20 days, et cetera, et cetera. But then again, with this smiling attitude, the spirit, and the spirit I'm talking about is one that recognized, I believe, I felt my humanity. I felt like my life mattered from the minute the doors opened and the moment I stepped into that room. The greeting that I got told me something about me and something about the person that I was greeting, who was greeting me, who was there to serve me. And so I also had this feeling, Andrea, I've described the process. It made me understand and visualize the North Point Clinic as if the clinic itself is what's the machine they were using? The respirators? Is that what they were using?
Yep, the ventilator.
The ventilator, yeah.
Yeah.
So it's almost as if the building was a metaphor for a life-saving, life-sustaining ventilator, not for the individual, but for the entire community. So I say that to say, I think there's an appreciation that's massive by individuals, and that my job as a communicator is to tell that story so that people who are hesitant or unclear about getting vaccinated vanquish those reservations, hesitations, those fears, and run to the opportunity, because like me, they want to embrace their grandchildren again and be around friends and be active in community in a way that's safe. So what do you think about that story?
I love that story. And as I hear that story, what I think is what you just described is trust, right? It's humanity, and it is trust. Trust that comes from believing that the relationship between you and the clinic is something that matters. And I think that is just a great example for us as a care system. Part of what we've been trying to do is use the voice of our clinicians to do some of that trust building. So 98% of our physicians have received a vaccine. That's an incredibly high proportion of clinicians receiving vaccine. And each of them has a story. And for our clinicians of color in particular, their story is so important, because within communities of color, we know there are some communities where there's mistrust of the health system, mistrust of health systems across the country. And so I think, that notion of how can we build confidence so that when you walk into a clinic, we care about you. We know, we have your best interest in mind. And so the voice of our colleagues across health partners in community has been really an important part of the strategy.
I have to tell you that my family and I all, we didn't frown. I'm not saying we had a tear, but I'm just giving you this as a metaphor. We have been customers over at the Riverside Clinic, and we love the clinic and we love the people that were there. And one of the things we loved about it was this whole evidence of diversity. And so it was wonderful to see African American, white, Chinese, Asian, Vietnamese, Somali people both being served and serving. And so there is a system that says all of us are here together for common good, for shared interest of our individual and therefore collective health. And I thought that was a wonderful experience every time I went there, comfortable being there. Now, that simply reminded me that, you and I go back to the early 90s when you started. I think you started off, one of the things under your portfolio when you began was a Center for, health promotion, I think. Was that you?
Right.
And I think one of the things that you emphasized in working with Insight News, when we were beginning to create our Insight Health initiative. We work with you to ensure that the content we created was medically sound, right? And our emphasis, and I think the instruction from you all was, let's make sure we do no harm, that we vet the information, and that we all are confident that we're serving the best information needs of the consumers as it can be, right? And I think that's guided us ever since that, in wanting to make sure that we're present in explaining health, explaining wellness, and partnering with organizations like Health Partners and others to keep this question of health top of mind in our community. I've gone on record saying that we have to develop this idea that our health is our business. And I mean that as a double entendre in the classic colloquial way, mind your business, right? But my grandma always told me, boy, you better mind your business. And she meant the business of being you and the business of your health. And health is a big business, right? How do we insert ourselves in the solution side of the health delivery equation? What do you think about that?
I think you're right on. And I think it goes right back to this notion of trust. And what's the relationship? Who do you turn to help support your own health and well-being? And I think oftentimes all of us turn to our family, our friends, our community. And so it makes it really important at Health Partners that we're engaged with community and we're engaged in co-designing care and the experience of care in a way that fits with the cultural backgrounds of the patients that we serve. It's also made it really important that our care team reflects the diversity of the people that we serve. And I think the experience you described at our clinics is one that I'm really proud of. I look across our clinics, and today we have 6 clinics where our proportion of people of color, patients of color, is 40% plus. Mm-hmm. We have another dozen clinics where the proportion of our patient base of color is between 25 and 35%. I know our organization is going to be better long-term as a result of being a place where everyone is welcomed, included, and valued. And we use that richness of the diversity of our people and our patient and our community to do better and to improve health together.
So, well, first of all, I'm Al McFarlane. You're listening to Conversations with Al McFarlane, and thank you for listening here on KFAI. And if you're watching on YouTube or monitoring this on Facebook Live, we thank you for being a part of this experience. We're monitoring the chat as well. So if you have a question to me or to Andrea Walsh, please send it in or make it in the Facebook comment area. Andrea Walsh, my guest, is the CEO of Health Partners, and Andrea is a friend of mine. And so, Andrea, thank you for taking the time to have this conversation with me here today. So I want to pivot and talk about what you see as the intersection between this conversation about COVID-19 and the conversation that our town is having and that the world is having right now about justice. And the question is highlighted by the trial that is beginning today with jury selection, the trial of the officer accused of the murder of George Floyd. How do those things intersect for you personally, if they do, and for your company, if it does, and for our community, if there's a way for you to juxtapose these streams of energy and ideas and challenges?
I think that's a great question, Al, and they absolutely intersect. You know, I think back to last May, June, when our community was on display really for the world, and people have referred to it as the twin pandemics, the first COVID surge, and then witnessing racism up front and personal in a way that you can't get out of your mind. And so I think that what ensued within Health Partners is similar to the conversations that happened across the broader community. And that is, how do we take a look at where we're at as an organization and as a community, and contemplate what are the steps that we need to take to really address racism and really make it a thing of the past. We didn't get to where we are overnight. We won't get out of it overnight. But I think, what I take away from it personally is we've got to accelerate our efforts. We've got to accelerate our efforts on a number of fronts if we hope to make progress. And, in healthcare, one of the really difficult truths that we just have to confront head on is we have some of the worst healthcare disparities in the country right here in the Twin Cities. And we don't talk about that often enough. So I think for us at Health Partners, it caused us to step back and say, you know what? We've got to do better as it relates to health equity and our work in health equity. We've made some progress, but we have to be impatient and address it with more urgency. And we have to take a broader look beyond just health equity to look at what's our role in education reform, what's our role in social justice reform, what's our role as community partners. And I think that a broader, more comprehensive look is exactly what's needed. So we've formed an equity, inclusion, and anti-racism cabinet within our organization, with the idea being you have to first look inside yourself as an individual, inside your organization, and then inside your community. And so that's really how we've begun our work.
So when you look back and reflect on this persistent, decades or generations persistent set of disparities and discrepancies, what conclusions do you draw? Why do these disparities exist, and why do they continue? How is it that we haven't been able to turn, the road on these? What are your findings?
Yeah, that is a great question, and it's a question that there is no silver bullet. If there were, it would have been asked and answered, and we would have solved it. Right. We actually retained and have been working with Sarah Bellamy from the Penumbra Theater, and our leadership symposium last fall. She offered a reflection, and she entitled it "The 8 Fates of George Floyd." And in her reflection, she talked about the structures that surrounded him as a baby, as a young boy, as a young man, and then as an adult, as an African-American adult in the community. And I think as I reflect on what I heard in the reflection that she offered up, it's a series of things. It is bias that exists in individuals. It's bias that exists in institutions. It is reinforced in the public policy structures. I think about the conversations about the Rondo neighborhood and where we put our highways in this community. And we're in a community where the reality is your health depends on the zip code you live in. And there's a 14-year difference in the average lifespan of an individual based right along I-94. And I think as a community, we don't talk about that. We don't showcase it in the same way. I think that's what's changing, is the willingness for us collectively to say, you know what, we can and we have to do better. We just can't, we have to end that.
I think Minnesota has a tendency to be very smug and very proud of our general, high marks for quality education, high marks for quality health, but we ought to be ashamed and dissatisfied with these blaring gaps, the disparities. And I think you're absolutely correct that we don't look at it in a way that's deep and that keeps us at the wheel, right? Really focused on solving these problems of discrepancy and disparity. So I think that that's exactly what we have to do. Let me ask you to talk about your own background. How did you come to this work? You've got a great background, but I'll let you tell it. How did you approach in your student life and study life and family life the path that brought you to your position of service and leadership right now?
Yeah, I feel like I've been lucky to spend almost all my career at Health Partners. I grew up in Rochester, Minnesota. My dad was a physician at Mayo Clinic. I went to college down at the University of Kansas, and then went to law school here in the Twin Cities at the University of Minnesota. And when I graduated from law school, I began a practice in law, but had the opportunity actually to take a little bit of a career sabbatical and go serve in the Minnesota Health Department. And I think for me, it really awakened my passion around health and well-being, and my passion for service of others in a way that's quite different than practicing law. I joined Health Partners back in 1994, and then over the course of essentially the last 27 years have had the privilege really of working alongside fantastic colleagues who really focus on mission. I love being in nonprofit healthcare, where our mission is enduring, and our vision enduring, and the culture of community service, something that just fits with me in terms of my personal passion. I've got 3 kids who are adults now, and a wonderful husband. And I was sharing with you, Al, before the show started that Tim and I just became grandparents this past year. So I've got an 8-month-old grandson who
Congratulations.
is really fantastic. Yeah.
Nothing better than that. That's wonderful.
That is,
you and I have a common friend in George Halverson. And in fact, I came into contact with your company when it was called, what was the original name of the company before it became Health Partners?
Group Health.
Group Health. That's it. Yeah.
Yeah.
And so George entertained me and a group of my colleagues who had created a company, an association called the Minnesota Minority Media Coalition. We exist today as the Minnesota Multicultural Media Consortium. But George was curious about how we looked at the industry's ability to engage and serve the cultural communities that we came from, that we represented. And I just really appreciated his willingness to roll his sleeves up and to engage us and to listen and to encourage us to speak our truth with confidence and with clarity and with the expectation that things would happen, things would change. And so you're following in the footsteps of a person I call a great servant leader in our community, George Halverson, and also Mary Brainerd, powerful, wonderful leader, and others as well in your company. So what's it like? And I think you're forging your own path, building on what, standing on their shoulders, but building new ways for engagement and a new vision, or an evolving vision of what health means for our society. What do you think?
Yeah, absolutely. I think both George and Mary helped set our organization up to be centered, mission-centric and mission-centered. And I think one of the things that's been unique about our organization is the diversity of our board. We're a consumer-governed organization, meaning that people who carry a Health Partners insurance card vote for our board of directors every year. And our board of directors serves at the pleasure of the membership. And we've had a long history of having one of the most diverse boards in the country. And I think why that has mattered, and tying it back to the conversation around health equity, I'll never forget back in the early 2000s, Willie Mae Wilson was on our board. And we at that point, and now it's hard to believe, at this point, we weren't collecting race data on our patients and on our members. And frankly, as an organization, we were a little bit tentative on how would we go about asking that question? Would that be offensive? How would that resonate? And I have to tell you, the discussions in our boardroom and the insights from our board members on how to approach community really set us off on a path. And Al, you were part of those early conversations as it relates to how to have conversations around children's health in a way that resonates in community and with family. And it's one of the things that I'm most passionate about is what can we do in co-design with community. So that's what I take from it, is our history has our organizational history stems from community design. And I think as it relates to how we tackle pandemics and how we address health inequity, co-design is going to be key.
That's a powerful word, I think, a powerful concept. And I've used the the word co-create in the same spirit. And my thinking has been that we have an obligation to see ourselves as co-authors of the future, right? That we have a duty to be at the table, at the drawing board, at the drafting table where we are designing futures in which we win. And that we can bring to the conversation an idea, a different understanding of what it means to win. That winning doesn't have to mean that if I win, you must lose. Winning can mean that everybody can win, and that there's a pathway for the entire community, the entire country, the entire world to win. And winning then becomes defined as a pathway, a system, a process for unlocking and enabling actualization or the fulfillment of what it means to be a human for every human being. That's what I think. How does that sound to you?
I really love that. I mean, I think about that as being a philosophy of abundance. It's like love. It's not limited. And it only expands when you're in relationship with others.
Well, listen, this has been a great conversation. I so enjoy talking to you, and thank you for all that you're doing at the company and in the community. Andrea Walsh, CEO of Health Partners. Parting thoughts, parting ideas. What lesson do you want people to think about as we go on our day-to-day?
Yeah, you know, I love this last part of our conversation around the power of co-creation, and it's just reminding me of something I'm really proud of, which is the work that the team at Regions and Health Partners have done related to our family birth center. And when I think about where we are as a community, the importance of really tending to those little ones and helping set our kids up for the future is important. So my parting thought is little moments matter. Brain development 0 to 3 in kids is something we didn't get a chance to talk about, but probably could spend another hour on.
Well, let's take a few minutes. I've got a minute or two.
Okay.
I think it's important. Because as you're saying that, Andrea, you just reminded me that my grandson Reggie was born at Regions in St. Paul, and so this conversation just triggers the memory, and it comes right back to me right now, and it's a good feeling, So, and George has been one of the pioneers in talking about brain development, and let's talk about that. Because I think we need to create a sort of a public awareness about how critical it is to protect the brain and to develop the brain, to nurture the brain with intentionality.
Yeah, so it's interesting. The science around brain development is 80% of your brain develops in the first 3 years of life. And so for babies, it's what's our obligation as a society to make sure every child has a healthy start. And I think that, in fact, today the Itasca group is launching a report around the first 1,000 days and the role that employers can play in helping make sure there are environments that help families support those little ones. And at Health Partners, we've had a broad partnership across the community and are trying to be good partners in developing a social movement around essentially building awareness around brain development in little ones. And it's called Little Moments Count. And it just emphasizes the importance of playing, talking, singing, reading, all those little moments, because that's what, in fact, develops brains and develops healthy kids over time. The number one predictor of a long, healthy life is a high school diploma. And so what happens in the first 1,000 days really sets you on a course for a healthy life. And it's not that at age 4, there's no catch up. You certainly never want to give up on a child after the first 3 years, but knowing that the first 3 years are so critical, it is something that we just want to get the word out on.
Kelvin, can you tell me if my next guest is in the waiting room? And if she is, let's bring her on right now while Andrea is here. I'm talking to Kelvin Curria, who produces the show. And there she is. I don't know if you know Ann Soto. but if you don't, meet Andrea Walsh. Now, I'm not sure why we're getting the feedback. Maybe it's, I don't know if it's my phone or yours, but Ann Soto is with United Way, and she is the director of grant making at Greater Twin Cities United Way. Let me check one of my my many package pieces of equipment here. That may be the reason that the feedback was coming. But Ann, thank you for being here as well. And the reason I wanted to bring her on while you're here, Andrea, is because Ann today is announcing that the United Way is making a fifth round of grants to community organizations, including ones that serve the things you and I are talking about right now. How do we serve families and young people in particular? And so, Ann, take a minute, if you would, introduce yourself and the announcement that Greater Twin Cities United Way is making today about grants to community.
Are you able to hear me okay?
Perfectly.
Okay. Hi there, Andrea. Great to see you. And very relevant, the work that you were talking about right as I entered, given the task force. Al, thanks so much for the question. And I work as the director of grant making for Greater Twin Cities United Way, which basically means that I get to lead a team that has been very busy over the last year with a set of responsive grant making activities that we have done to respond to the tremendous community need given COVID-19. We're excited to today be providing a final wave of grants as part of a larger COVID-19 response and recovery fund. The total of the grants that we're making today are just over $630,000. So we have the opportunity in that to be impacting a tremendous number of organizations. These grants are different than previous funding waves that we've provided, in that the strategy for these grants is very focused on supporting nonprofit organizational stability. We recognize that a year ago, the grants that we provided were centered on getting resources to organizations to respond to immediate needs of families. What we're understanding from our nonprofit partners right now is the need for organizations to continue to be responding to family and individual need. That work hasn't stopped, but also be thinking about the stability of their organizations. So these funds are centered around providing resources for nonprofits to think about strategic planning, finance, fundraising, governance, making sure that we have a nonprofit community that is strong and able situated as we hopefully turn the corner on COVID-19 here in this late spring, summer.
Let me say, as a disclosure, I'm on the board of Greater Twin Cities United Way, and I'm pleased to be a part of the organization. And you and the staff do phenomenal work. Thank you for what you do for our community. I tell people I like being on the board because when we have our board meetings, I'm in the room with a whole bunch of smart people who care. And that's a good thing. And so, Andrea, I'm going to throw it back to you. You're also involved in several major civic organizations. Take a minute, if you want to talk about the important work that is being done that you're part of as well, outside of your work directly as the CEO of Health Partners.
Yeah.
And if you wish, engage Ann. Let's have a conversation among friends about our mutual commitment to building a community that works for all of us.
Thank you, Al. I love the opportunity to talk a little bit about some of the fantastic work going on across our community. I sit on the Bold North YMCA board and have a passion around youth development. And so the work led by Glenn Gunderson and his team at the Y really is making a tremendous impact on childcare and children's health, fitness and well-being, and youth development. And so I'm proud of that YMCA work. I also sit on the Wilder Foundation board, and I look at the important contributions Wilder makes in the St. Paul community as it relates to supporting families and individuals with social service support, healthcare support, and community needs. And I think some of the work that Armando Camacho is leading there really is cutting edge, and the Wilder research is in particular of importance, because I think often for nonprofits, we want what we measure is what's important, and being able to show the value. It's something I know Anne has been important to the United Way. So I'm proud of Wilder and the work and commitment Wilder has made to research and evaluation, so that we can demonstrate that nonprofits in the community really make a difference as it relates to health and well-being and economic development.
And what are you discovering in grant making as changes that are positive and productive in the nonprofit sector?
I think the last year, and as I mentioned, the necessity to push resources out the door as quickly and responsively as possible, forced not just United Way, but a whole host of other peer funders that I'm in conversation with to really analyze our grant making practices and ask the tough question of ourselves of what process and rigor is important to obviously do the diligence that is needed in order to make sure that we're acting in our fiduciary responsibility with the resources that have been entrusted to us. But what also is not needed, and what can we do to streamline internal processes in order to get resources out into the hands of individuals that need it. So we have done a lot in this last year to make sure that our processes are reflective of that most responsive grant making type of practice. I think the other thing that is a absolute necessity, and Andrea, I heard you speaking to this earlier in the conversation that I got to listen in on that you and Al were having, but of being centered on community voice and what you refer to, Al, as co-creation. It is a imperative for grant making organizations to not be an echo chamber of our own making, and for us to be building strategy for me and my team that is within our grant making work with the resources that we have, to make sure that we're directing those dollars toward needs and efforts that the community is asking for, and that are most responsive to where there is, I think, voice of, for us, nonprofit partners. And so, for example, the way that our COVID-19 Response and Recovery Fund work unfolded was us starting with all of the members of my team out, and it wasn't in person in conversation. We were on the phone or on video with, we fund 95 nonprofit organizations with multi-year unrestricted grant funding. And we were calling on all 95 in the first weeks that COVID was unfolding a year ago, in order for the initial grant making that we did as part of this fund to be very much responsive to what are the needs of individuals and families. So those are a couple of things that come to mind, and informed directly by this last year really of work.
Andrea, we talked about your passion for children and infants. And are there major projects right now at Health Partners that are child-focused or family-focused or infant-focused? Are there major projects that you want to tell people about, where people can get more information or get involved?
Yeah, so I mentioned earlier our region's birth center. Over 60% of our patients who deliver at the birth center are people of color, and 25% of our patients need interpreter services as part of their care. And so we've been doing a lot of work with community to know and understand, how do we create a birth experience that's culturally sensitive. And so we've been working with community organizations organizations like Diva Moms, a Hmong community organization, to really build out and plan for care that is culturally sensitive. One of my favorite examples is our Hmong community told us that part of the Hmong birth tradition is having a special kind of chicken soup after birth. And so we literally worked with the Hmong American Farmers Association to be able to get access to the special spice that is used in the soup, so that in our kitchens at Regents Hospital, we could have the right soup that would enhance that birth experience. And I use it as an example of partnership within and across community, that it really makes a difference. I think the other thing is the little moments count effort that really extends into community and helps meet our patients and our members and people where they're at in their homes, in community, with family and friends, to emphasize little moments count and early childhood brain development. I would say that is an initiative, and actually Akua from the United Way was on the Itasca task force as part of that work. And I think, across the Twin Cities community, there is growing and building momentum for a focus on 0 to 3. I think it complements so nicely the strong focus there's been on pre-K, early childhood development. And I think beginning at birth is extending it a little bit earlier is the right step at this point in our community, as we look at what it will take to improve education outcomes for the long haul.
I'm Al McFarlane. This is Conversations with Al McFarlane. My guests are Andrea Walsh. She's president, CEO of Health Partners, one of the largest healthcare organizations in the country, based right here in Minnesota, and Ann Soto, who is the director of grant making at Greater Twin Cities United Way. And we're coming to the end of the program, but before we went on, Andrea, you were asking me a question about how the Black community is thinking about health. So let's have that public conversation, because I'm glad that you asked, but I'd love for you to ask that again, and let's go back and forth with that for a second or two.
Sure. Yeah, Al, I was just curious, as you think about the current state of health in our community, and the need for us to build trusted relationships and know and understand needs. I asked you about, and I'm interested in your perspective on where does health fit on people's agendas, and how within the African American community can we do a better job as health systems in reaching into community and understanding what the needs are.
That's a great question, and thanks for asking it. And I'm glad to respond as I see things, Andrea. I think health obviously is a high priority for everyone in the community. What our community is experiencing more and more is the ability to look at the interconnectedness, the intersectionality of all of the concerns that we have discussed as part of the social determinants of health. We don't look exclusively at health and not at transportation. We don't look at transportation and not at justice. We don't look at justice and not at the environment, that we have a unique ability or capacity to feel and to know, but also to understand the pressure that comes from consistent and pervasive exclusion that, while may not be identified, is something that we feel, and while it may not articulate itself as a wall to us, we experience it as a barrier. And so the question is, how do we develop the tools, the vocabulary, the language, to be able to describe how these things that we feel and know create constant pressure that's debilitating? How do we understand and learn ways to describe them that give us the power to also describe a solution that dismantles, their power to oppress? Because we believe that the oppression that we experience not only oppresses us, it oppresses everybody in the community, and that there are people who spend energy and time suppressing our opportunity, but they're wasting their own opportunity by being in an oppositional mode. How do we move from that kind of posture of competition to a posture of shared value, shared vision, a posture of cooperation, and back to what you said, Andrea, of co-creating, co-authoring. So I think that's the path that we're looking at. And I think that what I'm saying is what resonates abroad in the Black community. I have the ability to maybe articulate it because that's what I do. I'm a writer, I'm a journalist. And so I talk about stuff all day. But I think that what I'm talking about, people feel, and they know it, and it's true. And so it's wonderful that an Andrea Walsh raises the question and says to me and to us that I am concerned and I am committed to creating the kind of community that you envision, because I believe what you envision, it parallels what I envision, that we can have, that they're one and the same at the end of the day. And does that make sense to you? I mean, I'm just sort of throwing out, this is classic Al McFarlane, but it's what I believe. What do you think, Ann?
I appreciate what you encouraged there. And also, Andrea, your question, and I think both asking the question and then Al, what you just did, which is describing a reality in which I think there it is not a zero-sum game is important for all of us to hear.
Yeah, Al, as you were saying that, I was thinking, far too often in healthcare, we focus on defining the problem and fixing it instead of stepping back and thinking about what's the problem the community wants to solve, what's the problem an individual person wants to solve, and how do we focus more on healing and less on fixing. And it strikes me that that's a bit at the heart of how you responded. Like, get out of our swim lane and meet each other in a more comprehensive way.
We may have lost Al there.
I think you're right.
Still, I hit a button and disappeared. I'm back, so I must have missed something.
We thought you were giving us the reins to host.
Well, I was hoping you took that attitude because, yeah.
Nope.
But this is cool. This is wonderful. I'm having a great time. I thank you both. We're at the end of the program, actually. I've got about 2 minutes left, and I want to use that to both thank you, but to Ann and Andrea, give you the last word. But first of all, thank you both so very much for being here, and thank you for this wonderful conversation, and thank you for the work that you do in our community. And I want my readers, my listeners and viewers to know that next week the program is going to feature a favorite music group of mine, a group called the Hamiltones. They're R&B singers out of North Carolina, and they're going to be calling in, and we're going to just have a party on the air for next Tuesday. So I want you to come back and check out these guys that are masters of the idiom of R&B, and they're doing great work talking about social justice and about the classic themes of love and family and the boy-girl stuff, so it'll be a good show next week as well. Andrea, parting words.
I'm going to tune in next week. I want to hear the Hamiltones for sure. I guess my parting words are I think change travels at the speed of trust. And I think all the work that we have that lies ahead fundamentally is about being in relationship with each other and building trust, and building trust across communities.
And your turn.
Thank you for the opportunity to speak to the United Way work as it relates to our COVID-19 crisis response. Our organization has always been and is centered on disrupting inequity along race and income and geography lines, and Of course, with COVID-19, there's been disproportionate impact on those already experiencing the greatest challenges. And so this work is important. You giving ear to it is important. Appreciate it very much.
Listen, thank you both so very much. And to those of you listening, thank you for listening. Thank you for watching on YouTube and Facebook. We'll see you next week. I'm Al McFarlane. This is Conversations with Al McFarlane. Take care. Bye-bye. Bye-bye.
Thanks, Al.
Okay.
Nice to see you, Ann.
Bye.